Okay, well, thanks once again, Jason, at the Channel 14. I think we've been at this every Friday now for about 3 months, maybe a little longer. I'm not sure. We'll have to research that. And there was certainly no shortage of things to talk about that happened this week. It kind of all started out with a tweet by President Trump. There was a woman who was purportedly a doctor from somewhere that she was saying how great the hydrochloric quoxine or whatever it's called that the president has touted in the past, and hydrochloroquine, I think, is the pronunciation. But at any rate, she had said that she had successfully treated a lot of patients with it, and as it turns out, the woman later said that she knew that demons were involved, and when Twitter and Facebook and everybody else actually took the tweet down, she said that God was going to come and break up Facebook as a result of their actions. So she was pretty far out there, but he had tweeted that as kind of proof of his theories about this drug that's been thoroughly rebuked by the FDA, and Dr. Fauci later kind of weighed in on that as well, in terms of, people have to remember that this drug is not approved and actually can be very harmful to a lot of people who might think that it's safe to take. And unfortunately, our numbers have continued to spike in Wisconsin, and I'll run the numbers down a little bit. Starting in Kenosha, we now have 51 people who have died as a result of COVID-19, and there's 2,374 active cases in Wisconsin. That number of active cases is 56,111, and 928 people have died. In the United States, over 155,000 people have now died. And Wisconsin is one of several states that is spiking. We haven't been in the news that much, unlike Florida and Texas and some of these southern and southwestern states, California. But we are indeed spiking. We are spiking to the point where Illinois this week decided to add Wisconsin to the list of states that if somebody from Illinois comes and spends a few days in Wisconsin, and other than, not just for commuting purposes or driving through, but if they spend a couple days in Wisconsin, they are required to quarantine for 2 weeks, just as they are in some of these other more active states. And this, this is just an indication of how bad we are spiking, and it's also just one more thing that we have to be concerned about in terms of lost revenue, in terms of sales taxes of people who normally from Illinois frequently come to Wisconsin for shopping, and a lot of that will not be going on. So because of the spiking, the governor has decided that he is going to mandate that, when in public, that we wear masks, and that begins tomorrow. And we will now become, I believe, the 33rd state that will be doing that. And I would just like to say that, the science knows that masks are effective. And if we are ever going to get to the point where we are winning against this virus, we really need to do away with the spiking. We had largely flattened the curve until everything was wide open again, and now, unfortunately, what we anticipated happening is now happening, and the spiking is going on again. So we need to wear masks, not just to protect ourselves, but to protect our friends, protect our family, and to make it possible for us to return to as near of a normal as we can and as soon as we can. And this is a relatively easy thing to do. It may be an inconvenience, but compared with the death and ill health, and also the ill health that it does to the economy, is something that we just need to do. There is a $200 fine for noncompliance. We certainly hope and believe that there will not be a need for a lot of this. I think that if you forget to wear a mask in some place, chances are the officer is just going to give you a friendly reminder. But for people who are clearly in compliance, there is a $200 fine. It is really quite a situation that we're in, and we need to remember the basics. We not just the mask, but also social distancing. 6 feet is what is recommended. At least 6 feet is what is recommended, even when we're outside. And we are certainly encouraged to not participate in big events, especially where people are not social distancing and where people are not wearing their masks. It is simply not safe. Personally, last week here in Kenosha, I knew 5 people who came down with the virus. The last update that I had is one is still in the hospital, and this is something that can obviously not only take somebody's life, but also alter somebody's life in terms of lasting effects once having the COVID. So I just like to encourage everybody to, take this seriously. This is not going to go away easily. The mask order is for the next 60 days, and then it'll be reevaluated. But another thing that the spiking has resulted in is the school board decided that it was not safe at this point to start a normal school year. So everybody will be, all the students will be starting a virtual school year this year for at this time, an undetermined amount of time. And they will join several other communities, neighboring communities like Racine and Waukegan, and also Milwaukee, Madison, and several other cities throughout the state as well have decided the same thing, that, as long as we are spiking, that it's simply not safe to gamble with our students' lives. And no matter how they voted in terms of the school board, I'd just like to thank all of the members of the school board, whether they were a yes vote or a no vote. I know that they voted their conscience. I know that they voted after not only hearing the people at the public hearing, but the constituents that contacted them personally, either by mail or email or on the phone or personally. And I'm sure that all of these, I'm lucky to know all of the school board members, and I know that each and every one of them spent a lot of time doing their due diligence in terms of coming up with what they think was a proper vote, and I certainly don't want to second guess any of them. So I just want to thank them for their service to Kenosha. I guess I'll close with my normal closing. Please do all the things that we know are helpful. Like I said, wash your hands, social distance, wear the mask. And also, as I've said in the past, a lot of people are having a hard time with this. There's reports of increased drug abuse and alcohol abuse. And if you're having trouble with that or just generally coping, there's a crisis hotline that you can contact at 1-800 or 985-5990. Once again, 1-800-985-5990. And you're certainly also welcome to call my office at 608-266-0455. If you're having trouble with any of those things, or if you're having trouble with unemployment, feel free to give us a call, and we'll certainly do what we can to help. We did have some good news this week in terms of unemployment. We got the federal government to recognize that unemployment should be paid to people with disabilities. There were some Wisconsin laws that were disallowing that from happening, even though the people were laid off. So we were able to get that corrected this last week, and we continue to help a lot of people who are still having problem with their unemployment. So don't hesitate to give us a call. Once again, my office number is 608-266-0455. So Jason, once again, thanks for hosting me this afternoon. And I would have never I would have never guessed that we would have kind of a witch doctor being retweeted in terms of her opinions on the coronavirus at the beginning of the week, and certainly with the news with the mask and in the school situation, we have a lot to report this week, and I'm sure that there will be no shortage of things to talk about next week. So have a great weekend. I think it's supposed to be a beautiful week coming up. Remember, if it's still safe to be outside, and if you're not in a crowd, you don't have to. If you're not around people, you don't have to wear a mask. It's good time to walk your dog, and it's supposed to be cooler. And I hope you all have a great weekend and a great week, and stay safe. And talk to you next Friday.